Hello friends, I am Lavanya Bachwal, clinical nutritionist and diabetes educator, consulting at World of Women Clinic Vashi, Navi Mumbai. Today my topic of discussion is polycystic ovarian syndrome or polycystic ovary disease, very commonly known as PCOD also. Polycystic ovary condition or polycystic ovarian syndrome is very commonly seen nowadays, and frequently patients come up to us with polycystic ovarian syndrome, and it is very important to know what this condition is and to appropriately take preventive measures. So what is PCOD? PCOD is basically an endocrine disorder in which there is hormonal imbalance, because of which people or women may have irregular periods or prolonged periods for an elongated time. Now what exactly happens? There are small sac-like fluids which are called cysts, which develop in ovaries over a period of time. Though they are unharmful, over a period of time they cause hormonal imbalance. Because of this hormonal imbalance, you can see that people may gain weight, they may have excessive hair growth over their face and other parts of the body, and at the same time they may have excessive weight gain. So what exactly happens? So normally our ovaries produce some amount of androgens. Androgens are basically male sex hormones which are produced in small amounts. But when you're having a hormonal imbalance, what happens is this androgens is excessively produced by the ovaries, resulting in excessive hair growth, inability to conceive or infertility, and at the same time excessive weight gain. Thus, it is very important to also identify the sole reason why this is occurring. One of the main reasons that we can identify is insulin resistance. Now, insulin is a hormone and it is basically regulated by the sugar that we eat or the sugar from the foods. Now, whenever there is a hormonal imbalance, the body is basically producing excessive insulin and the cell is insensitive or resistant to insulin. Therefore, there is excessive circulating glucose, at the same time excessive circulating insulin, additionally causing imbalance and resulting in weight gain and other infertility issues. Now, what are the most common symptoms of PCOD? It could be irregular periods, it could be depression, anxiety, it could be hair growth, it could be difficulty in losing weight, excessive weight gain, sleep apnea, type 2 diabetes, pelvic pain, insulin resistance, excessive hair fall or male balding pattern. At the same time, there could be dark patches, etc. So thus, if you feel that there are some of these symptoms that you are likely to observe in yourself, it is highly recommended that you immediately visit your gynec and get it checked. So what is the treatment for PCOD? First and foremost, so definitely you should pay a visit to your gynec and get the appropriate medicine for your existing condition. Secondly, a lifestyle intervention in the form of diet change, exercise and stress management is very important. So when we look into diet change, what are the important no factors that you should definitely do? Firstly and foremostly, a very healthy and balanced diet. From balanced diet, it should equally include a good amount of high fiber, which will commonly come from your complex carbohydrates like whole wheat grains, legumes, fruits, vegetables. Secondly, it should also be high in protein or moderate in protein. So a lot of egg. If you're a vegetarian, then dairy products could be recommended, and at the same time paneer is a very good option, especially homemade paneer. And at the same time, if you're a non-vegetarian, you definitely have a host of items that you can relish on, like chicken, egg, fish and other seafood items. Thus, very importantly, a good combination of complex carbohydrate with moderate protein is highly recommended. Alongside, do not neglect fat. A good amount of healthy fat is very important, and by healthy fat I mean fat from nuts and seeds. So make sure that you are including a lot of walnuts, pistas and almonds regularly in your diet, and at the same time having some amount of flax seeds, pumpkin seeds, sesame seeds, etc., so that it makes sure that your food and nutrition is intact, helping you to curb some of the symptoms of PCOD. At the same time, keeping yourself hydrated is very important. A lot of times patients do forget to drink a lot of water. Very important that you regularly consume water so that in the long run you're not dehydrated and your regular body cycles are conducted nicely. Omega-3 fatty acids, a special mention. It has been really observed that if you consume a good amount of omega-3 fatty acids, which will highly come from walnuts, avocado, fatty fish, is likely to consume or curb the effects of PCOD. So I will definitely recommend that you do consume more of these. What to restrict? Definitely the restrictive zone is really large. All your junk food etc. has to be back outside. Women with PCOD are at a high risk of developing diabetes further in life if they do not take preventive actions prior when they know they have PCOD. So thus it is very important that they highly restrict simple carbohydrates. So all your refined flours or products made from refined flours like the bakery products, breads etc. need to be avoided, and at the same time all your junk food, pizzas, burgers etc. also need to be restricted so that you can curb, and these products will also help you reduce weight in the long run if you avoid consumption of them in large amounts. It is also recommended that you avoid soy foods. Soy is found to be, as research says, obstructing in ovulation process. Thus it is important to avoid soy and soy products. Caffeine and alcohol as well have been linked with infertility. Thus it is also important to avoid alcohol and caffeine if you are really wanting to cure or overcome your PCOD problem. It is very important that you look into these factors. Over and above, when it comes to exercise, very important, at least 30 minutes of high intensity exercise 5 days a week is highly recommended. And exercise may not be monotonous, that you're just going for walking every day. Keep changing your exercise regimes so that your body is constantly in a mode of change and it will react better to the exercises. Get into recreational art forms like dancing, swimming etc. so that you are more keen on doing these exercises rather than feeling it monotonous and a task to do. Lastly and not the least, stress management is very important. Managing stress is highly difficult in the fast changing paces that we have today, but yes, a lot of simple techniques like breathing practices. Take 5 minutes break from your regular schedule and do some deep breathing exercises. Keep a fixed schedule of your sleeping and waking up patterns so that you are less stressed. Before going to sleep, keep away from a lot of tech or your mobiles and your tablets so that you have a more calming sleep. And yes, get into some meditation which will also give you a calming effect. So some small changes in your regular lifestyle can actually help you curb a lot of stress and improve your holistic condition. Further, if you have any queries and would like to get in touch with us, please you can connect with us through lybrate.com. Thank you.